when we look at the inside and external structures of the kidney, so we know that the kidney sits retroperitoneal, so it sits outside the abdominal cavity. There's retroperitoneal fat and a retroperitoneal capsule around the kidney. This one doesn't have that capsule around it. It's been removed. So from the external portion here, we can see that we have our renal artery. So that's this red one here that has the red contrast in it. We have the ureter, which is going to take urine from the kidney down to the urinary bladder through the ureter itself. And then we have the blue vein coming out of the kidney as our renal vein. So renal vein, renal artery, and ureter. When we look at the inside of the kidney, we can see that the artery is bringing blood to the kidney itself. Once the artery brings blood in, all of the blood is going to come way out here at the cortex. So this kind of confetti looking area, this outer ridge that has the red and blue dots, that is all the renal cortex. And so that's where the actual filtration of the blood occurs, is clear out here in this outer rib. So the renal cortex is where we have our filtration system occurring at. Then after it's cleaned, the blood comes down into the renal venous system that is then going to dump it into the renal vein and then into the caudal vena cava after it's been cleaned. As that blood goes through and it leaves its deposits, those deposits are going to work their way down through these renal pyramids. And so all of these darker colored areas here are the renal pyramids. And so you can see that we've got some urine formation out here in these renal pyramids. As that renal pyramid comes down, we enter into the renal medulla, which is the whitish area or the collecting duct area underneath the or below the renal pyramid. All of that renal medulla and renal pyramid all lead down to the renal pelvis, which is kind of the collecting duct. So the renal pyramid, renal medulla, once it gets down here in this open area, this is all the renal pelvis. This is where all of the urine is collecting into prior to it leaving out the ureter right here, then going into the urinary bladder. So we have renal cortex, renal pyramid, renal medulla, renal pelvis, ureter, down to the urinary bladder. Okay? You will talk about the microscopic components of the kidney in lecture. This here is more just so you have an idea